Are you looking to live a happy, healthy, and independent life after your 60s? We all want that, right? Well, the truth is that exercise is the key component to achieve that goal. Starting a new fitness routine can be overwhelming, especially when you're over 60, and the risk of injury can be a real concern. Plus, those of us that are a bit older, the recovery time can take longer. In fact, did you know that 44% of people over 60 never return to exercise after an injury? But it doesn't have to be that way. That's why I'm sharing 5 fitness mistakes to avoid in this video. We can all get fit. So let's take control of our health together. So grab a cup of your favorite drink and join me as I explore how to get healthy and fit while minimizing the risk of injury. So let's get started. You may be wondering what makes me qualified to talk about fitness over 60. Well, although I may look young, I'm past my 60s myself, but that is not what qualifies me. It is learning from other senior patients while practicing medicine as a rehab doctor in my other life. That is what makes me qualified. Over the years, I helped hundreds of patients recover from injuries to the extremity, recovering from the stroke, or recovering from or immobility to chronic illness. And unfortunately, very few of them recover back to their original mobility status and well-being. The ones that did stand out were exceptional, and these were people that practiced some kind of sport since their youth age. The hardest part of our recovery is the transition between sedentary to becoming active. And this is where I come in. I help people transition this period effortless and with fun, even though they never practiced any sport in their youth. The approach is totally different from the younger group. The problem isn't on the lack of flexibility or lack of muscle strength or lack of cardiovascular endurance. The problem that I saw the most and put seniors at risk is their mindset towards exercising, which in this group varies from decades old of knowledge about how to exercise to people that has no idea and never exercised in their life. Whatever the situation is, with more and more seniors living longer than ever before, it is very important that we explore new territories to prolong our quality of life. And this brings me to make this video about 5 fitness mistakes that people over 60 do when trying to get fit and that can land them in the hospital. By being aware of these pitfalls, we can achieve the fitness we desire without any injuries. So let's dive in and see what they are. Mistake number 1, no pain and no gain. It doesn't mean that you cannot increase your load, your resistance, and your intensity while you're training. What it means is that you have to exert more wisdom, consistency, and precaution, as these senior bodybuilders have done. Besides, they probably have done it since their youth. There's a culture that is you don't sweat blood, that if you don't push, it doesn't hurt you, your muscle would not gain strength. It's the most dangerous mindset to carry over when you're exercising after 60. Pushing yourself to the point of pain, it only causes more damages to your tissues and your body, resulting in a longer recovery time. This could spell disaster for your fitness progress. Do not work out until you feel tired. Then it may be too late. Instead, focus on slow and painless gain to ensure you reach your goal. In other words, have fun and enjoy. End all the sessions feeling great. That is the key. Erase from your mind the idea that pain equals progress. The new thinking is that you gain more by doing less, and your body will thank you. Remember, your top priority is to avoid any injuries, especially sprains, that could delay your fitness progress. You go farther being the tortoise than the hare. Mistake number 2, not controlling your impulses. This can be a problem that leads you to serious consequences, especially when you're not aware of your fitness level or how much you can do physically. So let me share with a story to illustrate this point. Imagine you are at store and run into a good friend on a beautiful day. They suggest taking a walk around a big lake, and you impulsively agree to join them because you haven't been active for a long time. The problem is you didn't ask how long the walk is or think about your endurance, since you normally don't go on walks. You're excited to be in nature and accept the invitation without preparation. You start walking around the lake and you realize that it's a lot more than you bargained for. But there's no turning back. You didn't bring any water, and there were no stands selling any nearby. Despite eventually finishing the hike, you end up feeling a lot of pain and ache, short of breath, your head is pounding, and you're extremely thirsty. Your body is suffering through the stress you put it through the hike. But you think, I'm dehydrated, but I'll get back home and drink it up. Big mistake. Remember, after 60, your body recovers slower. In the days following the hike, you begin experiencing high blood pressure, dizziness, your skin breaks out, constipation, or diarrhea. You have difficulty recalling names. These symptoms are your body's way to tell you that the activity you did was way too much for your level of fitness. But even though you didn't feel extremely tired at the end of the walk, that was the adrenaline from the stress that you released that made you feel good. Once it wears off, you start experiencing the aftermath of the stress. Most people don't relate these symptoms to overexertion. Most people expect tiredness to stop the activities, but tiredness is the last symptom to appear. It is very important to be aware of this fact, because overexertion can raise the cortisol in your body, which can have a negative effect on your body, like for example weight gain. And you can check it on a video that I made about that topic here. Cortisol increases the storage of fat, but also raises your blood pressure, raises your cholesterol, your insulin, and your blood sugar, and other inflammatory conditions. Keeping a journal of your unplanned trips and record any new symptoms that appear afterward may help you discover where they're coming from and help you control your activity, as well as customize a good fitness plan for you. Next time you're invited to do something outside your normal activity, make sure to ask intelligent questions like how long the walk is or what the activity involves. If it's much longer and strenuous than you're used to, just plan the trip for another time until you get more fit. Remember, controlling your impulses is critical to avoid any health setbacks. It's also helpful to know your baseline of fitness level before you attempting any new exercise or any new activity. I personally track my symptom to adjust my fitness progress by using a symptom tracker sheet that I designed for myself. The other day, I went out for a 3 times longer walk than usual to try out my endurance. 48 hours later, I broke out in hives. And I quickly knew that it was due to that activity. Therefore, next time, I knew not to walk that distance. Therefore, I reduced my distance and continued training until I had no more new symptoms. If you want to track your own symptoms, download my symptom track sheet at the end of this video. It is a great way to increase your training without risk. Mistake number 3, not allowing enough recovery time. Continuing from the last story, or from mistake number 2, the same friend called you the following week inviting you for another walk, and you're still feeling the effects from the past walk. But you go anyway, thinking that the pain will just go away as you walk. Big mistake. This time you ended up ripping your Achilles tendon, needing surgical intervention. So you go directly to the hospital. And for those who don't know where's the Achilles tendon, is the tendon that is above your heel. Very often it gets broken or get ripped in people over 50 years old. And why did this happen? Because you did not allow your body to recover. Your muscles and tendon were still stiff. When you walk tired and stiff, you have a high probability that those tendons get a rip. It is a big mistake to expect that your body will just recover as when you were 30 years old. Things have changed and you have to adapt your activities accordingly. You progress much slower, but you're gonna get there, as you can see some of these senior bodybuilders have done. They did not get to this point overnight. Now you're smarter because you're aware of this mindset mistake. Do not go by your impulses. Control your impulses. And know yourself, know your body, know your fitness level. It's common for people to not connect health setbacks with previous events, which is risky and can lead to injury. That's why taking time to recover is crucial. And although there's not a set rule of how long do you have to wait, each body is different. Each body ages differently. And that's why it's very important to know your body and know yourself. So don't accept any long walk or any unusual activity until your body feels energized again. So download my symptom track sheet for you to begin tracking your symptoms and activity. At the end of this video, mistake number 4, exercise to beat your stress. Do you remember decades ago when you exercised intensely or had a hectic day, how you felt like a log at night afterward? Well, that was when you were younger. This may be true in the past. As we age, our body change. If you're over 60 and you just experienced a stressful day, it is not a good idea that you look for aerobic exercise to de-stress. On the other hand, it may impose more stress on your body. It may raise your blood pressure over time and injure the artery of your brain, heart, and the rest of the body. It may also raise your blood sugar, your cholesterol, your insulin levels. Your body cannot longer respond quickly to changes in loads. Instead, what it does is respond with raising their blood pressure. For example, who would have thought that swimming may raise your blood pressure? It depends how you swim. In my case, I was using swimming to de-stress myself after a long day in the hospital. But what I noticed that instead of bringing it down, it raised my blood pressure. This happened later after I was nearing my 60-year-old. So the best way to increase fitness is by doing it in a relaxed way. I'm not telling you not to swim, but don't swim gently. Just enjoy the swimming. Don't tell yourself that you have to swim 50 laps. Just swim until you feel great. Another activities to help you de-stress is take a stroll, walk, dance, bicycle without time constraint. If you're over 60 and suffer from high blood pressure, the best way to reduce your stress is through meditation. There are many disciplines that combine fitness with meditations like yoga, tai chi, or qigong. Remember, your body needs peace and calm so it can build muscles and bones. Mistake number 5, herd mentality. Believing that all bodies are the same, that what happens to somebody may happen to you, is not applicable when you're trying to get fit. This is more true as the calendar advances in our bodies. That's why it has been so difficult for people over 60 to stay fit. No one knows your body better than you. Nobody understands your pain better than you do. Your body is unique and reacts differently from others. You have exposed your body to very unique and different experiences over your life. We all react differently. Not even your doctor knows how your body reacts. He cannot tell you how much weight to lift or how long to walk. So don't follow what others are doing for fitness. Just follow your own self-well-being. Follow your body. Don't try to compete with others. You should only compete with yourself. You should ask yourself, how are you feeling this year compared to last year? And then make your adjustment. Don't try to give in to peer pressure of well-meaning bullies telling you that you are getting old and weak. They may try to get you exercise in the wrong place and in the wrong time. Remember to listen to your body and make the right choices. Not listening to your body and just listening to your mind is a sure way to land in your doctor's office or the hospital. And what do I mean by listening to your mind? Your mind learned from when you were little to follow the herd for safety. This is a basic instinct. This was back when you were little and you didn't have life experience, but now you do. At least you have more than 60 years of experience. So listen to your body. Your body knows exactly your needs at the present moment, not from 40 decades ago. So how do you listen to your body? Your body talks to you through symptoms like headache, a rise in your blood pressure, your skin breakout, tummy ache, diarrhea, constipation, inflammation, pain, mouth sores, dizziness, insomnia. That's why it's very important to track your symptoms. If you enjoyed this video, press the thumb up button. And now download my symptom tracker sheet. Go to the link that you see on the screen or take a screenshot of the QRS code, and that will take you directly to that site to download your symptom tracker, along with instruction on how to use it. And it's for free. Thanks for watching.